think these problems are so multidisciplinary, or transdisciplinary might be a better word. We're talking about factors like climate change, poor water conditions, different types of crises, humanitarian crises, and so on. And we can't really get to the root of the problem without thinking of how all of these systems are interplaying or working together. So I would say my background is in nutrition, but we've really had to engage people with clinical expertise, people with policy expertise, implementation expertise. Even if we have a recommendation that we think will work, there has to be a way of implementing it and adapting it to the local context. And I think that's where different players can come in and give perspective on that.
With COVID, the whole debate about the mask wearing and other safety measures, we needed so much collaboration from other sectors to get that message into people's mind. It was not just enough to the doctor to tell you about how bad COVID can be for your health. We need other kinds of approaches to translate that knowledge into people's actions.
Yeah, I think it is very important for different sectors to work together because there is need to synergize, right, to avoid duplication. I mean, if different sectors think about a particular problem, they can approach it in different ways, and therefore they're able to harness their resources and the synergies in thinking positively on how to look for a solution, rather than each working in a separate or in silos. That is they bring fragmentation in the process of looking for a solution to solve that problem.
I also think the finance sector and the political sector should be more involved, so they can see that one can get more bang for your buck if you do collaborate across sectors strategically. I don't believe that low and middle income countries and their struggles necessarily is because of too little money, but more because resource spending is not necessarily prioritized in a systematic, transparent and collaborative way. An example is that it's long been acknowledged that the global problem of over and undernutrition is not just a health problem, but yet still so often interventions to try reduce the burden often only comes from siloed health interventions within single countries. Learning from one another is key, and not only across different sectors but also across different countries. Neighbouring countries ought to work together on a wider range of health and education challenges, and not just literally contagious matters like infectious diseases. For example, what works and what doesn't work in our health and education systems. We can learn from successes and failures from one another. We do not have time or money to reinvent the wheel. We should rather collaborate and share lessons learned on a frequent, routine basis.
Rehabilitation is per definition intersectoral and multi-professional because so many professions are involved, like physiotherapists, speech and language therapists, physicians, the whole spectrum, but also different sectors. We work in healthcare, but for people with disabilities or experiencing disability or functioning problems, they also have problems in everyday life, in all social sectors, at work, in education. So that's why it's very important that we connect together. And obviously, to advocate, we need one voice and we work together. That's why the WHO created also the World Rehabilitation Alliance, of which we are part with Cochrane in the research work stream, the workforce work stream, and now also in the external relations group.
We need actually to sit down with different sectors and learn from how they're actually doing things and what they can bring us.
Cochrane, as a global organization, has been on the forefront of a lot of producing evidence synthesis, but we know we cannot do it alone. We need collaboration and we need to be able to work with our partners. There is a big movement now of us to create these opportunities of working together and make what we all aim to, that is evidence to support decision making, but ultimately saving lives. And we only can do it if we are at the table and if we also bring to the table our partners, both from high-income settings, but also low and mid-income settings. So we have a big challenge ahead of us. We do need to understand that we have a lot to share, and learn from each other. And I hope that we are in a journey that we are much closer to achieving our goals than we were in the past. So I'm very, very grateful to these amazing organizations that are working together to make it a reality.
There are several ways of working together through networking. Yeah, you can do like a joint proposal writing at the level of seeking for funding. You can work on a systematic review together. Yeah, you can identify a common topic that cuts across your own specific context. Yeah, and therefore you can synergize. You can work. You can think together to conduct that systematic reviews, exploring the different resources that exist within your organizations and your partner. I think, yeah. So that is one way. Another way is you could work together to develop a guideline, yeah, to be able to understand the realities across zones and at the same time the specificities that makes those differences. So I think those are some of the approaches that you can use to work together.
With all this knowledge that is being produced, especially actually in COVID, you remember that so many articles, research came during the first years of the pandemic. There was so much information that even general people struggled to know which was good information, which was bad information. The same thing happened for the people at the policymaking level. How can I take quick decisions based on good knowledge, and how to apart that useful knowledge from the non-useful knowledge that I have to. So we definitely need to develop more tools to make this kind of informed decisions, to synthesize all this information and to try to discriminate properly good information from, I'm not going to say bad information in the sense of maybe it's a not reliable source, but maybe it's a good source and the information is accurate, but it's not necessarily pertinent for the kind of use you want to give in the terms of a regulation or a public policy. Because so many times that happen that we have different sources, but not all are related to the problem you are trying to tackle. So that's a big challenge now.
The other things, when we generally think of intersectoral collaborations or actions from an evidence-based perspective, basically when we try to evaluate or when we try to measure these measures, it's the standardized formulas may not actually fitting. Because say, for example, cost-benefit analysis or cost-effective analysis, if we try to do, we can do it for an intervention. But it is very difficult to clearly differentiate, okay, what cost, what sort of stuff here. So it will also have a very broader impact. So we may need to think as a kind of package of interventions, or we may need to think in a very broader perspectives while we try to measure, and usual approaches may not actually help.
What I see is we're usually our own worst enemy when it comes to collaboration and basically the competition for resources. That's where things tend to fall down. It's not a failure because you want a vibrant marketplace, but at the same time, things that could be brought together for much more powerful impact often fall prey to that competition. And so I think commissioners of research, funders need to really be forearmed about the need for good coalitions, the need to take a broad view, the need to get all the right players in the right place to do things that are on a larger scale as needed.